Hi, my name is Kelly Sadauckas. I am a doctor of physical therapy, and I specialize in pelvic health conditions for individuals with both male and female anatomy. Originally, the idea for pelvic floor was to be sort of a owner's manual for anyone with a vagina and anyone who loves someone with a vagina. But then I started to reflect upon the many individuals with male anatomy that I've treated over the course of my career, and they need help just as much as the individuals with female anatomy. And in some ways, their information is even more scarce. So pelvic floor is an owner's manual for anyone with a pelvis, which is all of us. The main reason that we're here is because 80% of us will suffer some type of lumbopelvic pain in the course of our lives. 80% of us will also suffer some type of pelvic dysfunction, be it pain or incontinence, erectile dysfunction. We will suffer that. And when it's low back pain or radiating pain, we'll go in and see a doctor within about 2 weeks. But the average individual with a pelvic complaint, they're gonna wait 5 to 7 years. Can you believe it? It's ridiculous. And during that time, they're feeling alone and broken and hopeless. So I'm here to tell you, you are not alone. You are not broken, and there is hope. And we can get you on this trajectory to help you live your best life and get control of your body back. If your shoulder hurts, you will talk to everyone, including strangers on the train, about how your shoulder hurts, and they'll offer you advice. When your pelvic floor hurts, you don't tell anyone, not even your closest friends. And we're gonna change that. Pelvic floor physical therapy looks at not only the muscles specifically related to the pelvic floor, but also your overall lifestyle, your posture, your dietary habits, our mental health and communication habits. We work together to restore a more normal functional balance, to reduce pain and improve function. You see, things like pelvic pain, incontinence, and erectile dysfunction are common things that we see with aging, but that doesn't mean they're necessarily a normal component of aging. They're common because they're due to musculoskeletal coordination problems, and just because they happen to occur in the area of our body that's related to peeing and pooing and sex, the medical community tends to push them under the table and not address straightforwardly. Perhaps some of us never learned to use these muscles in the first place, and we need to initially habilitate the brain, help the brain find the muscles for the first time ever. Perhaps these muscles have been harmed by an injury or a surgery. Now it's time to rehabilitate them, to find your best motor patterns again. In my experience, I see individuals after complex injuries and surgical procedures every day, as well as standard routine prenatal and postpartum care. The key with core physical therapy is if we suffer an injury and we just go back to our normal daily function without working to awaken muscles, we have this brain-body disconnect that can become quite problematic and that can lead to chronic pain in the long run. How this happens is as soon as we suffer an injury or have a traumatic surgery, the brain tries to ignore that part of our body to try to protect us. It truly wants to help us. But it's not smart enough to do that completely. It can't ignore the pain completely. So it just ignores our position sense or our proprioception. So before the surgical event or injury or lumbar disc herniation, our core groups were active this much. After the injury, they're active 50% less. And even if our pain goes away, these don't naturally recruit back up. So it's very important after every injury that you have to go through a series of neuromuscular re-education activities to improve that brain-body connection. I say this because we want to address this brain-body disconnect before it becomes a functional limitation for you. If it has already led to a functional limitation, we can still help. But if it hasn't yet, you'll be amazed and humbled at how hard these introductory exercises are for you, even if you're pain-free in daily life. They can just augment all of our overall function. To fix this dysfunction, be it lumbar pain, pelvic pain, or leakage issues, we need to correct this muscular imbalance. Usually that means up-training the muscles of the abdomen and the gluteals and down-training the areas of excessive tension. We need to start seeing these pelvic floor muscles as for what they are, muscles. just like muscles of your shoulder or your knee. Muscles that can become damaged with repetitive activities, and muscles that can be improved upon with proper stretching, strengthening, and coordination training. I personally find it amazing that it's routine care for us to see an individual 4 to 6 months after an ACL reconstruction to strengthen the knee, and 0 times after a standard labor and delivery. I would argue that the challenges to the musculoskeletal system of the abdomen and the pelvic floor vastly outweigh any damage that the knee undergoes during an ACL injury. Think about the change in length of that muscle for 9 months during the phase where you're carrying a baby, and then how much that muscle has to stretch during delivery. And we just send you home after 1 day and say, oh, you'll be fine. And then we wonder why we hurt and why we pee our pants. So we want to change this. My dream is that the standard of care would be that every individual before any abdominal surgery, spinal surgery, and in the prenatal phase would see a skilled physical therapist to learn about their body, to learn about how they can improve their posture, safe exercise habits, and connect to these muscles before they go in for these surgical procedures. And then again, post-procedure, post-vaginal delivery, post-cesarean delivery, routine standard of care, even if you don't currently admit to or are aware of an incontinence or pain limitation, come to the PT to find these muscles again to ensure no long-term damage. It breaks my heart when I see a 33-year-old girl present to me in the clinic with a 10-year history of full urinary incontinence since the birth of her first child. 10 years that she hasn't been able to exercise or go out in public without fear of peeing her pants. In that 10 years, she's gained 20 pounds. She's depressed. That is an incredible amount of morbidity that we could have addressed had we just gotten those referrals directly. So now that you're here at Pelvic Floor, I want to tell you that I think your pelvis and your pelvic floor are worth fighting for. I want to empower you with the knowledge of how to connect your brain to the muscles of your body and live your best life and get back to the activities that you desire. Maybe you're here due to pelvic pressure from an organ prolapse. Maybe it's erectile dysfunction or pelvic pain with intimacy. Maybe you just want to sleep through the night without getting up to go to the bathroom, or you just want your body back after baby. You've come to the right place. As always, please consult a physician before beginning any new exercise program. And if you do notice a worsening of symptoms or any stark pain with the exercises, stop and go see a physician in person. I'm glad that you're here to join us in our pelvic health revolution. Let's begin.